Once a month, we check in with Dr. Shawn Jones over at Chattanooga Wellness. So this month, no surprise, he is standing by ready for a visit, and this time he's focusing on how he helps patients with neuropathy. Good to see you this morning, Shawn.
Hello, Julie. It's great to be on. I appreciate it.
So I was trying to think about how to set you up, and the truth is I was at a loss because I don't know that much about neuropathy. When I think about it, I tend to think about it affecting people with diabetes, but I think it's a broader reach than that.
Yeah, it does. It's really the number one cause of neuropathy now is chemotherapy. So you survive cancer, and now you develop neuropathy. That's the number one cause. Number two cause is post-surgical. Sometimes after back surgery or knee surgery, it'll affect the nerves and you start to develop neuropathy. And the third most common cause is, like you said, diabetes. High blood sugar will tend to degenerate it. And what we find the real cause is the decrease in nitrous oxide in the tissues. And as oxygen, especially nitrous oxide, decreases, you start to get the burning, the pain, numbness, tingling, balance issues in the feet, and creepy crawly feelings. You feel like you've got bubble wrap around your feet. That's a common complaint when clients come in to consult us about neuropathy.
Is it restricted only to your feet and your legs, or can it extend into other parts of your body?
Yeah, it's in the extremities. So it would be in the hands or the feet or both. Some people, unfortunately, have both. So we have to treat both areas. Now, what we do in the office is a lot different than other people do, and that's why we have a 98% success rate with our clients. You have to identify, first off, how bad is the problem. So when you come in our office, we're going to do a full evaluation. We're going to check 8 different sensations. And on those sensations, we're going to see how much sensation you have compared to somewhere where you got good sensation, like maybe this part of your arm. And we're going to compare it to your foot or hand and see how much more or less sensation is there. And that tells us the appropriate type of treatment or level of treatment that somebody might need.
So you've got a kind of a table next to you that you wanted to focus on this morning because you mentioned how you kind of treat it in sort of a comprehensive way. I think that you've talked before on the show, Shawn, about some of the laser therapies that you found benefit with, but it's more than that, right?
Absolutely. I'm putting one in here. In fact, let me show you what part of our home treatment is. Our rule of thumb is if it's less than 50% loss, you don't need home treatment. You can just come in the office for our neuropathy program in office only, and you're usually going to get great results just doing that. But if it's more than 50% sensory loss, if you have a lot of balance issues and stuff, then we send equipment home. Like this piece of equipment here, we love. I absolutely love this one. This one is an LED light thing that's very flexible. You put it around your feet, up your leg, around your thigh, wherever you're having problems, and it helps super heal tissues. Now the thing is, this is home treatment. We don't do this in the office because this is what we send home to people. Everybody else that's out there doing treatment are just wrapping people like this in their office. Now our rule of thumb is when you come in our office, I should do what you cannot do on your own at home. Spend your money on what you can't do, like the K-laser, myself doing the chiropractic care, and all the things like vibration therapy in the office. And at home, you do those things that you need to do. I love this piece of equipment because it's very versatile. You can treat everything that you need to treat with it.
Okay, I think that you incorporate a lot of nutrition into your philosophy too, don't you, Shawn?
Yes, I do. Yes, I do. Here's some of the basic nutrition we do. We use a product that increases nitrous oxide. This is the product we use for that. We use a product that helps give all the nerves the B vitamins and complexes it needs to heal the nerves. And then we also use what's called Circuplex, which increases circulation to your extremities. It's an organic whole food supplement that is pharmaceutical grade. Everything we use is pharmaceutical grade. And most importantly, we use the Prima DHA by standard process. It's concentrated fish oil, it's pharmaceutical grade, and DHA is skewed towards inflammation in your hands and feet. It's very important. And this is the one thing that after you're done with the initial 90-day program, this is usually what people keep buying and taking because you need it the rest of your life. It feeds your heart, it feeds your brain, and it decreases inflammation in all your joints in your body, but especially your extremities, your hands and feet. And that's very important. That's part of the nutritional part. Now, go ahead.
Sorry, I was going to ask you, so when patients begin this regimen with you, how long lasting is it? Is it something that they do for a period of time and then it goes away, or is it continual?
Great question. Yeah. Our program is set up on a 90-day program. We reevaluate you at 90 days to see how far along you've come. If I don't feel like you're there, we extend you 4 more weeks. Okay, there has to be an endpoint at some point, but we want to get you as good as we can. This is kind of like I tell patients, like on Johnny Carson, they used to have that guy that spun the plates, and he would sit there spin plates on these 6-foot poles, and they'd get caught up and he'd start screaming at TV, hurry, hurry. But once all the plates are spinning good, it keeps running good. You just tap it a little bit to keep it running good. That's why we send the home equipment home. Because once it's running good, treat yourself a couple times a week and keep it good the rest of your life. Don't ever let it come back. We want people to enjoy their golden years, to travel and do things. I don't want people to be homebound. You know, when I went through physical therapy school, they said if you're bedbound and you can't get out of bed, then pretty much most people die within 6 months. And that's sad because it's fixable. These things can be helped.
So if they're, did I leave anything out before I ask you my next question?
Well, I wanted to show, this is the power laser here that we use. The K laser is this is the 20 watt, $30,000 laser. Now this is what you obviously can't do that at home. So we take the laser and we laser the feet, the hands, and what all laser does is 4 things. It does the same thing. Number 1, it decreases pain. Number 2, it decreases swelling and inflammation. Number 3, and most importantly, it super heals tissue. And it also increases blood flow. So what it does, it makes the tissues heal much, much faster. That's why my twin brother, when we did laser, when he cut his hand and severed his nerves in his hand, they actually reattached in 10 days instead of 5 months like the surgeon thought, because the laser super heals everything. And that's why I use the laser. The other important thing is you have to treat where the nerves originate, in the low back, as well as the feet. This is why podiatrists can only treat up to the upper ankle. They can't treat the low back, so they can't get as good results because you have to treat where the nerve originates and where it terminates. Podiatrists do a good job, don't get me wrong, but you have to treat origination and termination, where the nerve finishes, to get full results. And that's why we have such a great success rate.
Okay, so how do people get in touch with you, Shawn, if they want to make an appointment?
Well, the best thing to do is, listen, we have a $49 visit. You come in, you get the full evaluation, your examination. We go ahead and do a full neuropathy treatment in office, and we include a second visit. When you come back, we sit down and go over a report of findings with you, and we show you exactly how much sensory loss you have, and depending on how much you have, depends on the type or level of program that you need to heal. And of course, the cost varies depending on if you need home equipment, or if you don't need home equipment. All that will factor into it. And we've been over backwards to help everybody. We have financing available. We don't turn anybody away from care that's serious about getting well. So if you call our office at 790-5000 or 643-2277, schedule your $49 visit. You got nothing to lose but your pain and numbness and balance issues.
All right. Always good to see you, Shawn. Thanks for your time this morning.
Hey, great seeing you. Thanks so much.
You know that fresh